Hello, and thank you for taking a few minutes to watch this video. I am the NHS Grampian Medical Director, Nick Fluck.
Hello, I'm Caroline Hiscox, NHS Grampian Nurse Director. We want to start by saying that we know how hard you're working and how much extra pressure you're under at the moment. We also know how overwhelming the current situation can feel, and that as well as working for NHS Grampian, you'll be caring for and worried about loved ones. We want to try and give you some information about some of the things you've been asking about. We know that you're asking lots of questions about personal protective equipment, PPE. You're concerned about whether we have enough equipment now and for the days and weeks ahead, and we're hearing that there is still confusion and misinformation about the equipment, how it should be used in certain circumstances. Clinical teams are working very hard with facilities on this issue. We're prioritising stock to make sure that you have what you need. Colleagues in Public Health and Infection Control are clarifying any remaining areas of confusion about which equipment to use in which circumstances, and there'll be more information about this tomorrow. At the moment, there is no shortage of masks and protective equipment. We're working with the National Distribution Centre to manage our supply and demand. However, we would wish to emphasise that there is no danger to staff walking through the hospital or ward areas. The wearing of droplet masks is not necessary whilst walking in public areas away from direct patient care, and this should be discouraged. PPE advice is clear from Health Protection Scotland and can be confirmed by our Infection Prevention Control team. Any concern should be escalated through normal channels for advice if you're concerned.
Testing has been live at ARI since Monday, and we will go live at Jubilee Hospital in Huntly on Friday and in Elgin next Monday. All staff testing is arranged via the dedicated email address, and full details are available at Covid19 NHSGrampian.org. Colleagues have set up an amazing system from scratch in less than 48 hours. Additional information on the testing protocol will become available through daily briefs and on the website. We have taken the decision to suspend visiting times at all NHS Grampian hospitals to limit the spread of Covid-19 and to protect our most vulnerable patients and ensure the safety of our staff. Visiting was suspended indefinitely from Tuesday at midnight. No visiting is allowed except when patients are at the end of life or if there is a clinical emergency in the following hospitals: Aberdeen Royal Infirmary, Royal Cornhill Hospital, Dr Gray's Hospital, Wood End Hospital, Aberdeenshire Community Hospitals and Murray Community Hospitals. Restricted visiting will continue in Royal Aberdeen Children's Hospital, where one parent only can visit, and Aberdeen Maternity Hospital, where one birthing partner can visit. We have feedback that getting personal effects such as clothes is now difficult, and we are working to resolve this. In addition to manage the access to our hospitals, we are making immediate changes to most entrance and exits. ARI and RACH have been in lockdown from 2 p.m. today, and others will follow shortly. This means that there will only be one entrance available to the public to access each of the two hospitals. One for ARI at the front door and one for RACH at the front door. Each of the two entrances will be manned by staff who will help the public visitor to find the correct venue and to gel their hands before moving into the hospital. Staff may enter any of the other entrances with ID swipe access, but care must be taken to avoid members of the public following you in. It is essential that we designate some entrances and exits for staff access only and limit entrances and exits for public access. This is a necessary part of our arrangements for dealing with the flow of people through our building and keeping staff and patients safe. Please read the signs that will be appearing at the entrances and exits. You might need to walk a little further or allow a little longer to get to where you need to be, but the signs are there for a reason. It is imperative that we all adhere to these new and important changes.
We know that being able to provide psychological support is really important. Our psychology colleagues are working hard to change what they normally do to make sure that they can look after staff, especially in areas of highest pressure. They're making sure that they can be responsive to the needs of staff, offering help at evenings and weekends, even if it's only general advice and signposting that's required. The main point is that we look after you while you're looking after the people who need your help. The best evidence of what's helpful and what is detrimental in the shorter and medium term will guide efforts. This will focus on brief psychological first aid, containing supportive conversations and debriefs at individual and team level. The psychology service will aim to be dynamic and respond to signals that staff and teams need help delivered in certain ways at specific times, or if they need something different altogether. As we work together throughout this pandemic, keeping you informed and acting on your concern is crucial. At the same time, we need to avoid overloading you with information, so it's a careful balance. The new NHS Grampian website, covid19.nhsgrampian.org, which is updated constantly with information that you say is needed, and there will soon be dedicated sections with more detailed, relevant issues for your area. The Covid-19 brief is produced every day. Thank you for getting in touch by email and phone with your concerns and suggestions. This helps us to understand what's important to you and how we can help. Please keep doing that. Thank you for watching, and thank you again for everything that you're doing.